Hi, my name is Adrien Danhauser and I'm with Just Physio, where we help active South Africans recover from their injuries and live pain-free. Today we're going to discuss the 5 most common knee pain we see here at the practice. There are many causes that can cause knee pain, but today we're going to discuss the 5 most common ones. The location of the knee pain can vary depending on which structure is involved. So let's dive into number 1, ligament injuries. There are 4 major ligaments in the knee, and depending on the mechanism of injury, you can actually tear one of them. Your physiotherapist will examine your knee and determine which one is off. The signs and symptoms to look out for is instability of the knee, difficult weight bearing, and there's usually a lot of pain and swelling involved. The treatment that you can do for that type of injury is for the first 48 hours put some ice on it and then to consult your physiotherapist. Number 2, meniscus injuries. The meniscus is basically cartilage in your knee. So the function of the meniscus is basically in the joint, it helps to make the joint a little bit more deeper so that the knee is more stable. So sometimes when you have a tackle on the one side and you fall, you can actually tear that cartilage. And that can give a lot of pain. It can also give you instability, swelling, and difficult weight bearing. Another sign to look out for is when you struggle to straighten your knee or when you struggle to bend your knee all the way. That can be a sign of a meniscus injury. Your physiotherapist will do certain tests to determine if the meniscus is off or not and also treat you accordingly. Number 3, patellofemoral pain syndrome. Now this is something we very often see here at the practice. Patients normally complain of pain in the front of the knee. It can be very painful when they go for a run or when they climb stairs, and sometimes just when they sit for long hours. It can also give you pain. The physio will do a lot of tests, but basically we will see if there is like weakness somewhere. A lot of times there's weakness in the hip and the core muscle. So what happens is you compensate but with your knee, and then you put a lot of loading on the knee area, and that can give you pain. So the treatment for that is to go on a rehab program to get your hip stronger and to loosen up the stiff muscles in the rest of the leg. Number 4, iliotibial band syndrome, or the ITB. This occurs normally in your runners. They usually complain of knee on the outside of the knee, and it normally occurs while they run, or it can get worse after a run. The treatment can sometimes be quite tricky, but the best is to come and see a physiotherapist. What we will do is we normally work on the stiff structures in the leg, and we also work on the weak components, especially in the hip and the core muscles. Number 5, patellotendinopathy pain. Patellotendinopathy pain can occur in the front of the knee, and it's normally associated with overuse. So basically when you do too much, your pain will get worse, and once you start to rest, your pain will get better, and it will almost do a cycle like this. So it can be quite a difficult injury to treat, so the best is to actually come and see a physiotherapist so that we can work out a plan on how to address the weak structures, the stiff structures, and also put you on a rehabilitation program to get you better. So there you have it, the 5 most common knee injuries we see here at Just Physio. Please remember that there are many other causes that can cause knee pain, and the best is to come to a physio so that we can determine exactly what is wrong with your knee and work out an individualized treatment program for you. If you like what we do, please visit our YouTube channel, subscribe, like our Facebook page. See you soon.